registrar on the ground and there are 3 babies who are sick at the same time, you cannot really spend. So the volume guarantee takes over, the same with the closed oxygen system as well. I mean, it makes it easier for us to do what we do, but we shouldn't be dogmatic about it. One point I would like to make here is overdistension. Why does it harm the baby? I mean, there are different things, and one is the carbon dioxide washout, which is very important for the brain development as well. And the chronic lung disease risk is increased if you're washing out, again, due to the overdistension. The vasoconstriction, which is produced by a low carbon dioxide, the hypocapnia, is going to impact the premature baby's brain vasculature and the circulation. So it increases the risk of PVL. Even if it's not visible PVL, you may get subacute or subclinical injury to the brain, so it may affect their future development. You do come across situations like lack of antenatal steroids. Despite the best efforts, there are some mothers who come suddenly and deliver even though they are premature. Maternal infection, chorioamnionitis. So these are situations you expect that the lung is going to be really stiff. And PPROM, for example, I mean, the baby comes out after a few weeks of prolonged rupture. So in these situations, you should have a lower threshold to give surfactant early, because even giving the normal pressure that you would use in these very stiff lungs is going to increase the risk of, it's like flogging a dying horse. So if you're using a higher pressure, you're going to break into the lung tissues. That's called the pulmonary interstitial emphysema. Thankfully, we don't see too many of those. In the days before the antenatal steroids were prominent, we used to see a lot of PAE. But PAE makes it very difficult for the lungs to ventilate in the acute stage. But also in the later stages, the risk of BPD is much higher in these babies with PAE. So these are the babies who typically go for the DART regime, steroids to extubate and so on. So